my experience with burnout, as I'll delve into, started from my own experience as a physician. And I experienced burnout for the first time when I was a medical student in Egypt. And then I moved to the States thinking that I would experience medicine in a much more fulfilling way. And I realized that the pressures on me when I was in Boston are even way more. And even though the hospitals were cleaner and the research was much more advanced, there was still something kind of gnawing at my soul, really. And my journey has been one of essentially trying to go beyond burnout, or trying to figure out what brings me fulfillment in life. And so I was fortunate enough to be able to switch careers. And so after my internship year, I went into clinical data analytics and started working with insurance companies around the States. And, so I had a job that was fulfilling to some level, included a lot of travel. It was very hectic because I was a consultant, but I really grew in this area of data analytics. And I was working with these insurance companies to help them understand how to make sense of clinical data. And that brought me back to square one, because after years of working with the data from the electronic medical records, we realized that the quality of the data was really low to an extent that we can't tell which provider did which procedure. And that brought me back to the problem of burnout again, and I didn't understand that it was burnout when I was younger. I just thought I was depressed and tried to deal with it as such. But then over my years as a consultant, I realized that the idea of clinical document integrity and what we're trying to do right now with electronic medical records and digital health is so deeply intertwined with burnout that we can't separate them. And we can't separate the quality of compassionate healthcare, which is the industry of compassion, from how compassionate doctors feel towards themselves and therefore towards their patients, but also how organizations provide this compassion to physicians. And so I've left my consulting job as well, and now I'm focused on researching and speaking about physician burnout, because I wholeheartedly believe that now more than ever is the time to deal with it, and organizations simply can't afford to go further in the way that we've been doing things. So according to the American Medical Association, urology seems to be the top specialty, but also things like family medicine, radiology, neurosurgery, and urology. Those are all very high when it comes to burnout, as opposed to psychiatry and surgery, which rank amongst the lowest. And so when you try to isolate one of them, and you can say, we tend to think of burnout as workload, right? But there's actually much more to it. It's about the sense of fairness, and it's largely about the sense of autonomy and control that you have. So with radiologists, they're being paid really well, but they have to do so much work, and they have to jump through so many hurdles to get a lot of things done and approved. And so this idea of prior authorization when it comes from the insurance companies, but also we're starting to look at things like, so there's this term now that's it's not exactly the same as burnout, but it's a subsection, I would say, of it, which is called moral injury, which is when you are trying to do the best you can for your patient, but legislation and admin work is not allowing you to do so. And so that's a really big issue when it comes to not just the differences between specialties, but also the differences between practicing in a large organization versus having a private practice. And Medscape's reports now, they have this report that comes out every year, and it shows that private practices have significantly less burnout than big ones, where you have to do all this paperwork and cross all these obstacles that are kind of unnecessary. And when you think about also the amount of time that you can spend with the patient, we are built up to be, healers. And so sometimes healing can't be done in 5 to 10 minutes. And so the more the organization puts a control of treating a hospital like a factory with crunching numbers, which, we've been seeing traditionally, physicians have been the owners of healthcare, and organizations have been led by physicians. But as it grew more complex, we started needing more and more business admin folk to come in. And so when you have someone with no clinical background that does not understand the critical components that it takes in terms of physicians being able to actually connect with the patient and do their jobs, and turning physicians into data entry clerks and taking away their time from their patients, which is really sacred and is the crux of this whole organization. That's where you see a lot of these problems. So it's not like a specific specialty per se, but how much of these 6 factors affect a specific specialty. So gender is an interesting one. The last research that I've seen is shows that it's not an independent variable. So looking at gender alone does not predict whether someone's going to burn out or not, versus all the other things that we talked about. However, the last studies that came out after COVID show that it is higher in females, but it's not. Again, it's you have to look at it next to what specialty they're in and what kind of practice they have. So jumping to a conclusion that female doctors are more liable to burnout or will burn out more frequently is erroneous, but it seems to be slightly tilted towards females these days. But also, like, a lot of the research that I read that is a little older showed that males are actually burning out more. So it's not one of the most important characteristics, it seems like. Do we need a pandemic to realize that telehealth or remote monitoring is a useful tool, but sometimes I think the only way forward is for us to be positive that we're learning our lesson here. It's it's like there's this quote in jiu-jitsu philosophy which says that if when you play jiu-jitsu, you either win or you learn. And I hope that that's the case for with this specific idea of burnout and pandemic. It's just, burnout is not new. It's certainly exaggerated. There's certainly a higher rate of suicide now. So with physicians, in the latest numbers after the pandemic, it shows that 14 every 100,000 physicians will commit suicide, compared to I think the number is 12 in like normal society. So it's 4 times as much almost. So what's going on there? The pandemic showed us that, but I don't think we're going to be able to bounce back without some big changes. And it's like climate change in that regard. Exactly. Like we won't be able to move as humanity, as like human beings, without having physicians being able to treat us when we get sick. And the way we're going is that a lot of physicians are going to realize, well, either young ones are going to look at these stats in post-pandemic and be like, okay, I don't want to go into med school anymore, or the older ones are going to leave their practices, which is happening frequently. And so in order to change that, we have to realize and face the brutal facts. I don't think I have advice, but I will re-emphasize some of the things that I think are empowering for younger people. And it's really about getting to know yourself, because I think there's a stigma against almost like knowing yourself or expressing your feelings, or looking at things like they might not be your fault, like you might not be alone. And so I think the most empowering thing for any younger person to understand is that if you're feeling lonely, or if you're feeling ashamed, or if you're feeling like you're not doing enough, the number one thing you want to do is probably the last thing that you feel like you want to do, which is talk about it. And so sweeping it under the rug is almost an act of self-betrayal. And so the system is rigged against you, and there are the healthcare, the infrastructure does not pave the way or make it easy. But the more you guys are able to talk about it and bring it to light, the more all the research and the numbers and statistics don't have much meaning without people that are speaking out and asking for what they need and asking for a new profession, because the previous generations just messed it up. Like the including mine, like the previous generations, just we did not ask for what we needed from the healthcare profession, and that's how we got to here in the first place. And also we let go of control. So the first step to regaining that and bringing healthcare back to physicians that actually understand what it takes to treat a patient is to speak up. And speaking up is not like it's not like this act of rebellion of oh, we're going to, like, destroy the system or whatever. Maybe that's part of it, but really it's a very vulnerable conversation to have, and you have to learn the tools to be able to express yourself vulnerably to others that you trust first before those that you distrust. Like, just talk to the people around you and tell them, hey, I'm feeling like I can't handle this anymore. I'm feeling like this depersonalization. So use all the things that I told you today as language to describe when you're feeling bad. And seeking mental help is always the advice, but that doesn't cut it sometimes. Like, you just need to introspect and really start looking at, okay, I'm feeling that way, and then when you talk about it, you realize that you're not the only one, and that's where change happens. So that's the edge, and it's not easy. So speak up and don't be afraid to be vulnerable, but that's how you change things.